Oh, hey gang, how's it going out there? Welcome to the new normal at Austin Dental Spa here in beautiful Austin, Texas. We just had a meeting today, getting ready to gear up to go back to work with my whole team. Here's the new personal protective gear, personal protective equipment. PPE has now become one of the common terms in dentistry that wasn't utilized much prior to that. This is a level 3 mask. We have our KN95s, which is another step above this. This is like 5-ply, filters out 95% of the particulates in the air, as do the N95s and the KN95s, but you can't get those son of a guns right now. They're diverted all to the medical industry, but they're starting to open up some supply routes for dentists, and I'm going to pick some up this weekend of the KN95 mask. The gloves have been standard operation for a while. This is my level 1 mask that I can use when I'm just going in to talk to somebody, but requires more than 6 feet of space. If I'm just doing an exam or talking to a patient, but I'm going to be closer than 6 feet, this is a level 1 mask. Much more comfortable and easier to breathe through than that level 3 mask. But right now, because PPE is in short supply, they are saying that a face shield like what I had on here and a level 3 mask are sufficient in lieu of a N95 or KN95 mask. So the world's going to look a little different the next time you come into the dental office, whether it's our dental office or any others. This is the new normal. Gloves, I just wanted to wear these because I wanted to show you. I see so many people out there wearing gloves now that haven't been doing it for the last 30, 40 years like we have. And they're touching everything in the grocery store and touching their faces. And gloves don't have any magical antibacterial properties to them. They can get just as dirty as your hands, but you can't wash them off with soap and water quite as easily. But these latex gloves, there is a way to take them on and take them off. And the way to do it, you don't stick your thumb up underneath. I'm not going to be using these again anyway, but I see people doing that. That is a no-no, because you've just contaminated this glove. But the way you do it is you grab this part and you loop your gloved hand underneath it and you peel it off this way. And then you do the same thing on this side. You get underneath it with your bare hand like that to peel the other side off. So there's 2 different ways to do it. And that way you're not contaminating yourself and your hands with whatever got on those gloves. That's the whole idea of wearing gloves, is to protect your skin from being cross-contaminated. And you should take them off like that, where the one you took off is being rolled up inside the other one, and you're still touching it just out there on the outside edge, and then drop it in a proper receptacle. Austin Dental Spa, we just put down our protocols in cement today that we are leaving our front door open. We've been doing that for 6 weeks now, to where you don't have to touch anything. You can call us from your car if you're more comfortable that way. We will send a dental assistant or a hygienist down to your car to get you and escort you from the parking lot up to the office. We're not requiring that because the vast majority of people have said they're fine. You can get in our front doors of our office with either your elbow or your knee on the automatic door opener, and you don't have to touch anything. When you get into the inside, you can hit your elbow against the elevator button and get all the way up into our office without touching anything. As soon as you arrive in our office, Meredith or Diana are going to use a digital thermometer from about 4 or 5 feet away. It looks like an Arnold Schwarzenegger movie. You're going to have a little red dot on your forehead. You don't feel anything, but it's digitally taking your temperature. Anybody with a fever or a temperature over 99 degrees Fahrenheit we will ask you to reschedule your appointment. If it's under $99, great, you've passed go, you can collect your $200, and there will be a dental assistant or a hygienist. If they didn't escort you in from your car, they will be waiting right here. Once you're in the office and we've taken your temperature, we also will have a bottle of Purell. Starting Monday, we're going to have a little table sitting outside the office as you walk in the front door with a couple of bottles of cold Ozarka water and some hand sanitizer so that you can have the option of doing that before you even come into the office. But we're very serious about hand hygiene, more so than ever before. I thought we were doing a great job before this coronavirus came along, and now the standard has just been raised up several more notches. So no one's going to sit in our beautiful reception area for the month of May. So when you make it past the front desk of the office after your temperature's taken and your hands are sanitized, we'll be taking you back. It's going to look a little bit different than any visit you've had here before. Our clinical team will all be wearing surgical gowns, and some of them have elected, although it's not mandatory, to put their hair into surgical bonnets. They'll all be wearing protective eyewear or shields, or some of them both. We'll all have masks on, so we'll still be smiling and waving at you, but you probably just won't be able to tell for sure unless we got the crinkles in the eyes. But most of our patients are coming in wearing masks now too, and so we'll just have to make do with the elbow bump and the virtual hug and the wave. But we're taking this safety very, very seriously. So you'll see my dental assistants in their gowns. There will be, at any given time of the day, at least one person walking around wiping all the countertop surfaces down. Every surface will get wiped down at least once per hour, including the handles to the doors, even though the door is going to be propped open. So we're not taking any chances. This place is clean, and we're going to keep it that way. The last thing we want is to put you in danger or any of my team in danger. So we're overdoing it to the extreme on the other end of it for your safety and for our safety. We'll do your dental treatment. Most likely, it's all going to be done with a dental assistant and a dentist in the room, me or Dr. Slagter, and from start to finish without any of us leaving the room unless we're taking an x-ray or something and I need to step out into the hallway. But we'll complete your procedure and then you'll be escorted up towards the front desk. We have touchless checkout systems now where we can text you on your cell phone or your iPad while you're still sitting in the dental chair with your invoice for that day, and you can actually pay it before you even get up out of the dental chair. Or if you're coming up to the front desk because you need to make another appointment, we have 2 brand new consult rooms that we put in back in September, October when we did our remodel, and you'll be able to sit in there in a 3-walled private room. You'll be the only one in there to where you can talk to my front desk people from a safe distance, and they can walk you through using your device to take care of things. If you don't have a smartphone or if you don't feel comfortable putting your credit card information into your cell phone to send to us from as far away from here to the camera, then we will put gloves on, mask on, and my front desk will take your credit card, wipe it down, run it through our scanner, and then wipe it down again and hand it back to you, all from a safe social distance. And then you'll be able to leave the office. You can schedule appointments online by talking to one of our team members remotely from your house or your car, or we can schedule it right here from this far away without you having to touch anything. If you're okay with that, we do have iPads where you can sign your name, but that's not absolutely necessary. So we're trying to give you plenty of options that are as safe as you feel the need to be. We can go from DEFCON 1 all the way up to DEFCON 5, depending on what your comfort level is. Your safety is our #1 goal. in addition to, I've got to put a caveat in there, we still are going to do great dentistry. We're just going to do it in a really, really safe environment as long as this whole thing lasts till we see the numbers start going down. We're hoping to see the reality being that we're at the other end of this pandemic, and that it's safe to get back out there. It's safer than ever before to come to the dental office right now. You won't see probably another patient in here. And if you do, you certainly won't be sitting next to him in the reception area, or you won't be sitting in the reception area at all for at least a month. So hope you'll take this to heart. And if you're needing some dental work done, come see us. We'll be happy to take